Okay, so then I'm not gonna go do it because there, but I would go and sit down at the tables. So I'm at the tables and I'm looking through here. I note the allergies, make sure I have the right patient, and I'm gonna start my first med. And the first med is furosemide, 20 milligrams PO. So I'm gonna go inside my med box and I'm gonna look for furosemide 20 milligrams. Now remember, these are Practimeds, so the spellings aren't gonna be 100% the same. So like this one's missing the E, okay? So if you have any questions about that, myself or Nancy will be up front and we can help you. It's pretty easy to figure out because you have just the meds that you need to get. Remember, if one of your meds is not in the box, where is it?
In the Pyxis.
Pyxis, and so you'll have to go with Nancy over there at some point and pull it as part of your 15 minutes. Remember, you don't have to know how to utilize the Pyxis. She'll run through that for you, but we just want you to show. And then so for the next checkoff, we'll have you go over there and maybe she'll log you in and then have you actually push the button so you get some chance. Okay? So I have my first one. Furosemide, 20 milligrams. Furosemide, 20 milligrams. I have 20 milligrams. So I don't have to do any calculations. There's no half tabs, 2 tabs, that sort of thing. I have the correct dose. PO daily. You're going to assume you're going to administer all the daily medications. Whatever's on your MAR, you're administering. Okay? And so then I have that one. Okay, the next one I go down and I have prednisone 5 milligrams. I'm going to look in the drawer. I found prednisone 5 milligrams. Prednisone 5 by mouth daily. So I have that one. The next one is fiantin 100 milligrams oral suspension by mouth every 6 hours. PRN, not for pain, but for seizure-like activity. So this is my suspension, and I didn't put one in the Pyxis just because so I could show you guys. But so here's my fiantin. This says 100 milligrams is what ordered. My bottle says 50 per 2, so I have to do the math. Okay, so I would do whatever formula you use. But if you use desired, I desire 100 milligrams, so my desired is always coming off my med sheet. I have in my hand 50 milligrams times my vehicles times 2. So anybody can do the higher math in their head? 4. So 4 mLs is what I need to give. Okay? Do you think that I can do 4 mLs in here? No. No. So remember, we have the oral syringes. So you could pour it into one of these cups and pour up the 4 mLs in here. Okay? Make sure you know how much is in a teaspoon, how much is in a tablespoon.
And then if there's any left over in the med cup, we waste that. Right?
Yep, you just waste it, dispose of it.
And we have to, like, it's not proper to pull it right out of the bottle.
Nope. Nope. You gotta pour it into a cup first. Okay? And then draw it up. Okay? So next thing, I know I have all of my meds and I have the correct dose, so I would do a quick once over once again, say furosemide 20, furosemide 20, prednisone 5, prednisone 5, fiantin 100 milligrams, I have 50 per 2, so I would write right on my med sheet that I'm going to give 4 mLs once I've done my calculation, so I don't forget that. And then now I need to think of what supplies do I have. I don't have to cut any pills in half, so I don't need a pill counter. That's automatically ruled out. So I need a few med cups. I like 1 med cup to put in my packages that are still in the package. You're never going to open anything prior to going back. All meds will be poured, opened, back in front of the instructor. And then I like a few other ones, at least one more, that you'll need to actually open the meds in, right? Because we don't know who's touched these. Do you want to put meds in here and then somebody has to put it up to their mouth and take them? Probably not, okay? So usually I take a stack of usually you're okay at 3 in case you drop one on the floor. Same thing with these, I usually take 2 back, okay? Return anything that you don't use that isn't got medication in it. Alright, and then I know I also need a oral syringe, so I can keep that there. And so I have all my equipment, and then I would want to go through and I would want to find them in my drug book, right? Because I'm already pre-thinking about that pre-administration assessment. So I want to flag just these 3 or 4 meds that I have to give. So have a blank note card, have the note card that you made, however you want to do it, flag it in your book, whatever system you use, okay? So then one last thing is I make sure and I go Brittany Green. So this is doing my first check of 3. 6/20/91, 6/20/91. She has allergies of aspirin. She has a diagnosis of abdominal pain, and it will make sense tomorrow. Your diagnosis will match your meds, so you want to make sure that the reason she has the meds ordered, she either has a history or she has an admitting diagnosis for it, okay? So I want to make sure that those all match, okay? And then I go back through, and you can do Lasix 20 milligrams, Lasix 20 milligrams, PO daily, done. Prednisone 5, PO daily, done. Same thing, Piotinin 100, I have 50, and Benadryl 4 that I have written in here, done, okay? So, I have all my supplies, so I know I'm good to go there. The rest is just making sure that you're prepared with your pre-assessment stuff, and then you're gonna come back with your checkoff. You'll have your patient's name will be on the board, or Nancy and I will also tell you you're in bed 2 with Cindy. Okay? So you know you'll take all your stuff. You won't take the whole med drawer because the next group comes in 15 minutes while you guys are back there. So you take your supplies that you need and your MAR and that sort of thing, but then you put the med drawer back. Okay? So then it's going through its things. I'm checking my health provider's orders, I'm reviewing my patient's chart, checking for allergies, I'm going to do hand hygiene, I assembled my appropriate equipment. You might want to take back I have a liquid, so making sure I have a little towel or a tissue. And then we already did check, you just need to verbalize, I did check 1 and 3 up there, I went through and did my 9 rights, right patient, drug, dose, route, time, documentation, allergies, reason, response, refusal, what else? Route. Yeah, I did route instead of allergy, or allergies instead of route. You do all those through, okay? So your 9 rights. Then, you don't have to say those again. You don't have to say the 9 rights over again. But when you're doing your 2nd and 3rd check, like I did with the MAR, that's how you do your 9 rights for the drugs. And then you just have to say, I checked for the right reason, response, and refusal at the end. And the patient always has the right to refuse. And then you're going to introduce yourself to the patient. Hi, my name is Jen. I'm going to be your nurse for today. I have your morning medications. Can you please tell me your name and date of birth? As they say that on the mannequin, as they're saying their name and date of birth, you're checking the name band, okay? So you're confirming what's on your MAR to their name band, and it should match, okay? Then you're gonna go into your pre-assessment. So that's when you get your drug book out, your cards, whatever you have made, and you go through, right? So if I'm doing this, and I grab my med book and I look at, if I look at it and I have my pre-administration stuff done, I'm going to say, if my first drug was acetaminophen, I'm going to say it's acetaminophen because it's a generic name, brand name is Tylenol, classification is a central analgesic, clinical, it's a non-narcotic, antipyretic, it's used for headache, fever, and mild to moderate pain. Precautions in hepatic impairment, therapeutic effect is analgesic and effect. Onset is less than 60, peak is 1 to 3. Duration is 4 to 6 hours. Half-life is 1 to 4. You only do the lifespan if it's applicable. So if you have a kid, then, and there is younger patients, then you would do that. If you have a elderly patient, then you'd have to do lifespan. Otherwise, if it's a routine adult, you don't have to do lifespan. Watch interactions with alcohol. It can be administered by mouth, with no regards to meals. Tabs can be crushed if need to be. 3,000 milligrams per day max dosing. Normal doses come in 325 to 500. Side effects: hypersensitivity, nausea. I'm going to assess for pain, onset, type, and duration. And for clinical improvement afterwards. Family teaching: I'm going to teach not to take longer than 10 days, and the max of 3 grams if over the counter, and avoid alcohol. There's 1 drug done. See how kind of quickly you have to go through that. And it's a lot of repetitive, just repeating what's in your drug book, but it's getting you to think, what do I have to check every time I give a med, okay? So once that's done, I'm gonna do hand hygiene again, and then I'm gonna check the meds 2 of 2. So in front of the instructor this time, I'm gonna go and grab my MAR once again and be like, I have Brittany Green on the ID band. I got furosemide 20 milligrams, PO daily. This is loop diuretic, and so I would want to know that they have a history of heart failure, and that before I give it, I would want to check things like blood pressure. I know this is all in your book. Potassium level, things like that, to give a few. Okay, so Lasix 20 milligrams. Next one I'm going to do is prednisone 5 milligrams, PO daily. It is a corticosteroid, so I know that this patient is getting it for their bronchitis, and it is a safe dose, and you'd want to go through and do your second attempt. And obviously, the prednisone, I'd have to go through and do the pre-administration before that. I do all your pre-administration on all 3 or 4 meds, get it done and get it out of the way, okay? And then now I'm doing my second check, so I'm going through all my meds. So I did my Lasix, I did my prednisone, and then the same thing. I'd go through and do my Beyond.
Can I ask a quick question? I might have missed this, but when you were reading off all the things you have to say for a med, do you do that for every single med, or do you just pick a couple?
You know, every single med that you're going to give, all 3 or 4, you have to read that off.
Okay.
You can see it took me less than a minute, right?
Right.
So it shouldn't take that long as you're organized and doing it.
Are we able to write on the MAR at all, like if we wanted to do that during like?
You can write on the MAR as long as on the MAR you don't write in the administration time, because when you're through with the procedure, you have to document that you have given this. And for this first time, we'll walk you through it, but the next checkoffs will make sure I want to know how to do this. So you sign your initials, date, time, and the correct hue of the time, and then you initial and sign down below. Okay?
If we want to write any notes, like,
In the box here is the only thing I would ask.
Okay.
In the real world, you wouldn't write on a MAR. But for our practice here, you can write on the side of the MAR, you can write on the back of the MAR. You want to write your 9 rights down on the back. You can do that. You can do your 9 rights off to the side here and check them off when you do them your 3 times. Okay? However you want to do it. Okay? Always think of with the meds, is there a vital sign, is there a lab, what do I have to check as the nurse? So when you're looking at that nursing assessment, those are the important ones that we're looking for each med. Okay? So I've done my check 2 of 3. Next, I'm going to go on, I'm going to talk about, in the checkoff, about if the medication was, and I brought one just for show, if the medication was a multi-dose, that I would pour into the cap, right? I would pour my, maybe, correct dose into the cap, and then into a cup because I don't want to pour more than what I need, okay? So does not touch the medication, pours the medication into the cap, pours the correct number of tablets, capsules, whatever that you're giving into the medication cup. At this time, I could be wearing gloves. If you're worried about touching the pill whatsoever, like I was confident in myself enough to pour it into the cap and pour it into there, and so I was okay. But you, anytime that you have to use a pill cutter, you better be wearing gloves, okay? If it is a unit dose, does not open package, places the entire package in the medication cup, open the package in the patient's room, at the bedside without touching the capsule. So remember when you're opening these, they can be kind of tricky. So look where your pill is, look to see if it has an opening, if you can just, a lot of times I try to just hold it here and then rip here and then squeeze it over in, okay? So depending on, you might have all of these, you might have all of these. So you have to verbalize both ways of doing it.
So do you only have to verbalize what you don't have though? Like if I
No,
had,
you have to verbalize both.
okay, even if you do have that message.
Yes, you have to verbalize both. So that way, there's no accidentally missing one or the other. If you know you have to verbalize both, you have to verbalize both. Okay. If necessary, then if you have to give more than a whole tablet, it has to be scored, right? So it has to have that line on it. And then you do it with a pill cutter and you do it with gloves. Okay. You never break an unscored tablet or obviously ever a capsule. Then you verbalize if the patient's having difficulty swallowing, checks to see if the pill can be crushed. If it can be crushed, you're not going to have any crushed. This is just all verbalization. We only have one crusher, so nobody's going to have to crush, okay? And then you're going to put the patient in high fowlers, and then offer them a sip of water, and now you're going to complete check 3 of 3. So once again, I'm going through Brittany Green on their ID band at the bedside. Date of birth is 6/20/91. I'm checking the ID band 6/20/91. Allergies to aspirin, not given aspirin. Diagnosis is heart failure and bronchitis and seizures. So I know that all my meds make sense for my patient, the right reason. So I'm going to go right drug, furosemide, right dose, 20 milligrams, PO, it's a pill, daily, right time. It hasn't been given. And then this is the point where I'm going to open it up and into a clean one, open it up, and then dispose of the wrapper, go on to my next one. Prednisone 5, daily, hasn't been given, good to go, open it up. And you need to ask your patient, do you want to take them one at a time or all at the same time if they're pills? And the instructor will answer, okay? So if they want to do one at a time, you open one at a time. If they want to take them all together, they're all pills, you can put them all in the same cup, okay? Otherwise, you always do the pills first, and I save the liquid for the last one, okay? And then for the liquid, or then you have to talk about, so that completes check 3 of 3, and then you have to talk about if patient isn't able to hold the cup up to their mouth, that you would assist them, maybe you'd ask them, never pour the pills into the patient's hand because they're generally going to end up in the bed or wherever. So you hold and on the mannequins, you're just going to hold it up to their mouth and simulate, don't actually put the pills down the mannequin, it'll get stuck. If it needs to be mixed with food, that you're mixing it in one of these little oral med cups, you're not taking your crushed pill and pouring it into a whole thing of applesauce, right? So you're just taking it with a little bit of food in that. And then you need to talk about sublingual. So I give sublingual, it goes under the tongue and let it dissolve thoroughly. Make sure that they don't have anything to eat or drink until it's completely dissolved. And then buccal goes in the cheek. So I'm gonna, with gloved hands, you would do either of these if you had to place them for the patient, and then make sure to place the medication between the cheek and your teeth, or their teeth, and until it's completely dissolved. And then it goes into liquids. So if you have liquids, you gotta make sure and shake the liquid if necessary before opening the container. Place the bottle lid upside down in the on the counter. So I'm not gonna go like this. I'm always gonna go this way down so the inside of the cap does not touch any of the unclean surface area. I'm gonna make sure that the label is against my hand. And this one kind of has a little label on the back, but we're looking for the main part of the label is against my hand. And I'm gonna pour the correct amount. So I know I have to give, what did I say? Four, right? So I'm gonna pour probably 5 in here, so I know I have enough. So remember when you're pouring liquids that you pour them at eye level, and then you twist and lip, and then I would wipe with a tissue, replace my cap. So there, you're good. If I didn't have to pour it up in an oral syringe, I would have to get down to eye level and I would check it. I would make sure that my instructor checked it. Before you open any of your package, make sure your instructor has a visual on it before you open it. And make sure you raise them in a high fowler, make sure they're all set there. If they can do it, then you let them do it. If not, if I had to pull this up, which is when I do, then I would have gloves on at this point. I would simply pull up. And I would make sure and get any excess air out. There's no needle, so I don't have to worry about that. And then I would push up until I got to my 4, and then you could administer your 4. Okay? So that's how you would do the...
You said you would wear gloves for that?
Yes, I would wear gloves. Anytime you're functioning with open meds, I would wear gloves, especially during a checkoff. In real life, if I was dealing with oral medication, I would always have gloves on, because you don't want to risk any time it's going to absorb through your skin. And then you're going to dispose of all supplies, and then you're going to document on your MAR. And remember on your MAR, so if you're checking off from 1 to 3, it's in the first row of columns, and you write down the time you gave it, your initials, date, time, and then sign down below. Initials, date, time, and then if you're after 3 o'clock, you gotta move over to the next section. Initials, date, time, initials, and sign, and then you're all set. And then you give this to the instructor with your checkoff at the end. Okay? Make more sense?
Yeah, thank you.
So it's your pre-administration is critical. You